Okay, so thanks everyone for coming to our first lecture in our public lecture series. My name is Casey Garrison. I'm a senior lecturer in the School of Information and Communication Studies at Charles Sturt Uni. And a part of this project led by Dr. Sabine Wardle in the School of Social Work and Arts. Okay, so before we start, I'd like to just do the acknowledgement of countries. As members of the CSU community, we acknowledge the words of the Wiradjuri people on whose land our university was founded and share their aspiration of Yindimara Wananana, the aim for us all to learn the wisdom of respectfully living well in a land worth living in. We pay our respect to the traditional custodians of these lands where we live and work, and I extend that respect to any First Nations peoples present here today. I'm coming to you from Gadigal and Birrabirragal country today. So feel free to pop an introduction into the chat and tell us where you're coming from. Okay, so just before we get into Beth's lecture, just a little bit about our project. So the SWIL, the Social Work and Libraries Online Simulation Hub, facilitating industry engagement project, aims to promote partnerships with public libraries by bringing social work to communities at the grassroots level, promoting co-design research and enhancing pedagogy for social work and information studies students. It has been funded through the Australian government's National Priorities and Industry Link Fund, NPILF. And as part of this project, we're going to be hosting a few public lectures across the next 2 months on various Thursday mornings and lunchtimes. And we're very excited to have Beth for our first series. So with that, I'll stop sharing. Beth, feel free to start sharing. And I would just like to introduce our first speaker, Dr. Beth Wahler, who will be presenting about trauma-informed librarianship today. Dr. Beth Wahler is a research faculty affiliate and previous director of the School of Social Work at the University of North Carolina at Charlotte and founder of Beth Wahler Consulting. She is a researcher, educator, consultant, and social worker that has collaborated with individual libraries, large library systems, and statewide library organizations throughout the US to conduct needs assessments of their patrons' needs, psychosocial needs, and staff challenges with these types of patron needs, provide psychosocial needs and reduce staff stress, and has created and piloted various interventions to address patron needs while also supporting library staff. She has presented internationally on these topics and has published numerous articles on library patron and staff needs in peer-reviewed journals. She is co-author of Creating a Person-Centered Library, Best Practices for Supporting High Needs Patrons, which excitingly is coming out in December 2023 and published by Bloomsbury Libraries Unlimited. So with that, I'll hand over to you, Beth.
Thank you, Casey. So I'm really excited to have the opportunity to talk about trauma-informed librarianship today. It seems to be a hot topic right now. It's one of the most popular things that I talk about these days. So I really appreciate the opportunity to talk to the group today about this. So you gave a nice introduction to me and my work. I, sort of fell into library and social work collaborations by accident about 8 years ago, but I always say it's been a happy accident. And I have been in academic positions full-time until recently when I left my academic position at the my full-time university position at UNC Charlotte as the director of the School of Social Work to run my consulting business full-time, which is Beth Wahler Consulting. So I do a lot of work. I originally started working with libraries specifically around assessing patrons' psychosocial needs. So things like mental health, substance use, homelessness, poverty-related challenges. And as I started working with libraries and started initially working around social work collaborations with libraries, my work has really transitioned and sort of broadened over these last couple years to also include staff needs and staff stress and leadership strategies for reducing staff stress and trauma. So the conversation today about trauma-informed librarianship is actually addressing some different strategies that libraries can use to meet patrons' needs, but also support staff and reduce some of the staff stress and trauma that's happening. So, oops. As Casey mentioned, I've got a book coming out in December, and the title is a little misleading. The title was selected by the publisher, and the title focuses specifically on how libraries can support high needs patrons. But again, the book really about half of it talks about high needs patrons and strategies libraries can use to address patron needs, but really about half is focused on organizational strategies libraries can use for supporting staff and again, reducing staff stress and trauma. So I wish that they had had something about staff in the title because it's a little bit misleading about the book. So the objectives today, I'm going to talk over the next hour, a little bit less than an hour now, about the basic principles of trauma-informed practice and what these look like in a library setting or how these come into play in a library. We're going to talk about examples of trauma-informed librarianship. I'm going to have some information about how library-based social workers can help with trauma-informed librarianship, but also address strategies that libraries can use even when they don't have a social worker on staff. So just a little disclaimer that most of what I'm sharing today comes from research and work that I've done in the US. Some aspects may be similar and are similar to what I've learned about Australia and other parts of the world, but the different cultural context has to be taken into consideration, and certainly more research needs to be taking place in Australia for those of you that are coming from that country. I think we have some audience members from several different countries here tonight. So first I want to talk about, before I talk specifically about what trauma-informed librarianship means and what that is, I want to talk about the changing needs of libraries and how work has really changed over the last decade or so to impact library staff. And what we've seen over the last decade is that the psychosocial needs of library patrons have really been increasing. And the top areas of need that we see in public libraries, but also other kinds of libraries. So we're seeing similar things in school libraries, academic libraries, some special libraries. But most of the research I'm sharing today comes from public libraries. But the top areas of patron need that we see are homelessness or unsafe or unstable housing. We see patron needs, patron mental health challenges and mental health needs, people that are sometimes having mental health crises in the library. We also have seen an increase in substance use that's taking place in the library. And in many libraries, we're seeing increases in overdoses that are happening on library property. And then we've seen a general increase in poverty-related needs of patrons. And these needs have really been increasing, really pretty steadily over the last decade, but then they increased dramatically with the beginning of the COVID-19 pandemic and have been increasing pretty rapidly since. And although the frequency of these needs varies based on the library and the context that you're in, we do see these same kinds of patron needs rising to the top in rural, suburban, and urban libraries. So no matter what kind of community context a library is in, we're seeing high numbers of these same kinds of needs. And again, in smaller libraries or more rural libraries, we often see lower numbers of people with these needs just because there are lower numbers of people served overall compared to a large urban library. But we see these same kinds of patron needs, and these patron needs are really causing a lot of stress for many library staff who aren't necessarily trained to work with people who have these needs. And many of these needs are trauma related or trauma associated, and I'm going to talk about what I mean by that. And many of these needs also can cause trauma for people that are serving these populations and serving people with these kinds of needs. So when I say that a need is trauma related or trauma associated, what I mean is that it's not necessarily caused by trauma directly, but it's related to trauma. So when we look at homelessness or mental health or substance use or all of these kinds of psychosocial needs, what we see is that people with these needs are highly likely to have experienced trauma preceding the development of this kind of need. And then once they have that need, they're more likely to be exposed to further trauma. So thinking specifically of homelessness, for example, when we look at populations of people who become homeless, many of them experience trauma before they ever became homeless. So when we look at teens who become homeless. Many were fleeing situations where they were experiencing abuse. When we look at women who are experiencing homelessness, many of them were fleeing situations where they were experiencing abuse. We see, many men who are experiencing homelessness who experience some kind of violence or trauma earlier in their life. And then once somebody becomes homeless, they're exposed to a lot of different traumatic incidents. So people who are experiencing homelessness are much more likely to become assaulted, to be assaulted in some way again, and sometimes repeatedly while they are experiencing homelessness. And we can go through all of these kinds of psychosocial needs and see those same relationships. So when we have patrons in our libraries who have these kinds of needs, many of them have experienced trauma and have experienced chronic or ongoing traumas. And then again, these kinds of needs can cause trauma for staff who are working with these patrons, and especially staff who don't feel like they're adequately trained to work with these populations. So when we're talking about trauma, when I'm using that term tonight, I'm talking really broadly about trauma. And here in the US, the Substance Abuse and Mental Health Services Administration has a 3E framework for understanding trauma. And this helps us understand why two people can experience the exact same incident. And one may be highly traumatized by that, and somebody else may not experience trauma from that same incident. So, for something to be considered trauma, there have to be three things present. One is that there has to be some kind of event, there has to be something that happened to that person. Then it has to be experienced in a highly negative or frightening or very, very scary way. And then there has to be an effect after that incident is actually over, after that event has ended. So that second E, that experience, is largely impacted by our own previous experiences, by our personality, by other traumatic things that we may have experienced in our life. We all experience things differently because of our own context and our own culture and our beliefs about things and how we make sense of the world. So again, we can experience the same event, and for one person they may be able to just go about their day like nothing happened, while somebody else may be highly, highly affected by it. And this is really challenging often for library directors or library supervisors because they have staff who are experiencing these same events, but often very differently. And so when I do needs assessments of staff groups, it's not uncommon for me to see staff who've all experienced the same incidents with patrons, and some are struggling with continuing their job. They're struggling with mental health symptoms that they're experiencing, and then other people in the library are acting like things were no big deal. So that's because of this framework and how we all experience the same events differently. So when we look at trauma in general, we again are considering it very broadly. And traumatic incidents can be anything. So they can be any kind of assault or violence that somebody experienced. They can also be a time when somebody has witnessed violence, witnessed somebody else being threatened or harmed seriously. Trauma can be just experiencing the fear of being assaulted. So maybe not actually being assaulted, but being afraid that you're going to be assaulted or killed, or again, seeing somebody else being attacked. Life-threatening events like a severe accident, car accident, a serious medical event like a life-changing medical diagnosis, all of these things can be traumatic for the person who experiences them and can cause different trauma responses, which we're going to talk about in a minute. We also have a category of traumatic incidents called adverse childhood experiences, or ACEs, which are things that happen to people before the age of 18 that can be any of the things that you see on this list, some sort of assault or violence, but they also can be other things that just threatened that person's sense of safety. So when we think about being a child or an adolescent and having a parent who's suddenly incarcerated and out of the home, or having caregivers that suddenly split up, or experiencing homelessness as a family and not being sure where we're going to stay, or not being sure how we're going to have enough food. These kinds of things impact a child or an adolescent's sense of safety and security in the world, and can also be perceived as trauma and cause a trauma response. When we look globally at the number of people who've experienced trauma, 70% of adults have experienced at least one traumatic event in their lifetime, with many people experiencing multiple traumatic events or chronic traumas. 61% of adults report experiencing at least one ACE before they turn to 18, and 1 out of 6 adults report experiencing 4 or more ACEs. So when we look at these statistics, most of us, by the time we get to be adults, have experienced some sort of trauma. So when we are thinking about people coming in our libraries, we're thinking about our coworkers in our libraries, we can feel pretty confident that the majority of people have survived some kind of trauma in their lives. And again, some people have been through chronic traumas or multiple traumas, and the impact of trauma is actually cumulative. So people who've been through more trauma or experienced more traumatic events are likely to have more significant or more severe trauma responses. So we're going to talk in just a minute about different kinds of trauma responses that are really normal in people who've experienced traumatic incidents. And it's important to remember that these trauma responses are really our body and our brain's way of adapting to harmful circumstances that happen to us. And these adaptations can last long after the traumatic event is over. Sometimes they may last for a short time, sometimes they may last somebody's entire life. And again, the impact of trauma is cumulative. So when we look at people who've experienced multiple traumatic events or chronic traumas, we tend to see more severe trauma responses. So on this slide, you see different kinds of trauma responses, and the kind of trauma response somebody develops can vary based on the age they were when they experienced the trauma, what kind of traumatic event they experienced, again, how chronic that was. So some people may be impacted in one of these areas, some people may be impacted in all of these areas, but all of these can be really normal trauma responses. So I'm going to start with the kind of upper right when we look at this slide. And trauma impacts our cognitive functioning in many cases. So people who've experienced trauma, it's not abnormal for them to have trouble forming memories, trouble concentrating, trouble remembering new information, really thinking through and making decisions, and even sometimes processing or expressing language. As we move clockwise around this diagram, you'll see on the middle right, this slide talks about how trauma can impact our physical and mental health. So trauma can impact the likelihood of us developing some kind of physical health condition like diabetes, heart disease, cancer, a sexually transmitted infection or disease. Trauma also impacts our likelihood of developing a substance use problem throughout our life or developing mental health symptoms or attempting suicide. On the bottom right, this talks about how trauma can impact our perceptions and our beliefs about the world. So, people who've survived trauma have sometimes their core beliefs about the world, how safe the world is, how secure things are, is actually changed by the trauma they experienced. And they may have less of an ability to hope or less optimism about the future than somebody who hasn't experienced trauma. On the bottom left, we also see that trauma impacts our relationships with others. So it's not uncommon for trauma survivors to have trouble identifying people who they can be in healthy relationships with, have trouble forming healthy relationships with others, have trouble expressing their own wants and needs or setting boundaries with others, or understanding and respecting boundaries that other people may set, or picking up on things that the needs and wants that their friends or family members or people they're in a relationship with are trying to communicate to them. And again, trauma can impact somebody's ability to trust other people or to feel safe with other people. And on the top left, this talks about how trauma impacts emotional regulation. So for people who've experienced trauma, they may have trouble controlling their impulses, may have trouble interpreting emotional cues of other people or picking up on emotions of other people. And they may really just have trouble kind of knowing who they are and again being able to communicate that in a regulated way to other people. So all of these things are really normal trauma responses, and which ones we see vary based on the experiences that that person has had. When we look at library patron populations, we tend to see some common behaviors in patrons who have experienced trauma. And again, all of these things and how this shows up in your library in a particular person varies based on the experiences of that person, what kind of trauma they experienced, how old they were, how chronic the trauma was. But it's really common for us to see patrons who have trouble with social interactions or have trouble reading social cues. They may dominate your time or have trouble telling when you need to move on and help somebody else when you're trying to hint that you need to wrap up the conversation. They really just struggle with picking up on those social cues. We see people who often are really irritable or easily escalated or rude. You know, they may instantly become really angry when something is out of their control or something happens that was unplanned. We see patrons sometimes who stay very isolated, or the opposite. We see people who are sometimes overly social. So sometimes people want to be left alone. Other times they may be the person who is talking to every single person they see. And again, they're not picking up on those social cues that people may be a little irritated or annoyed with them. We see patrons who use drugs and alcohol. That's really common for people who've experienced trauma. We see people who want the library to be silent and they get really upset or they feel really uneasy when things are loud or there's a lot of noise around them. And then again, sometimes we see the opposite end of that spectrum and we see people who are very loud and almost create chaos everywhere they go. So we can see either end of that spectrum. We see people who become angry when things go unplanned, and we often see patrons who have inappropriate sexual behaviors and may make inappropriate sexual advances or may flirt inappropriately or even cross the line into sexual harassment sometimes. So these are all really common things that we see in libraries from people who've experienced trauma. And I'm sure those of you in the audience who work in libraries, though that list of behaviors is pretty familiar to you. So now I want to talk for a minute about how trauma impacts library staff. So what we know from library worker populations is that many library staff have experienced trauma. And sometimes it's firsthand trauma that they've experienced outside of the workplace. It has nothing to do with the library, but as we were talking earlier about the prevalence of trauma, people who are working in the library have had many experiences outside of the library that have been traumatic. We also see a high number of people working in libraries who are experiencing trauma in the workplace because of patron challenges and patron needs. We also see staff who are experiencing secondary or vicarious traumatization, and I'm going to talk about what that means in just a second. And we see staff who experience burnout. And these things are, they're all distinct, they're different, but they have some overlapping symptoms and way that they impact people. So there's a growing body of research on library staff trauma, and what we've seen is that frontline or public-facing library workers from all types of libraries in all types of communities, so again, urban, suburban, and rural, report high rates of trauma from workplace incidents, and over half in my own needs assessments report experiencing violence in their job. The incidents that staff describe include being verbally abused by patrons, experiencing physical aggression and attacks, being threatened with violence, threatened with weapons, being sexually harassed, and having people come in and destroy library property. These incidents have increased since the beginning of the pandemic and are continuing at this point to either stay steady or increase depending on the community. The current political climate is really contributing to these increased threats. So some of what's happening in the library is because of these psychosocial needs that we were talking about, people that are having problems with substance use or mental health. But some of the challenges we're seeing in libraries are actually unrelated sometimes to these psychosocial needs. And we see this growing number of threats to library staff and library directors, and threats to intellectual freedom based on people's political beliefs and trying to control the types of collections libraries have or the types of events that libraries have. Because many of these threats are specifically related to library collections or events or programs that are related to sexual orientation, gender, diversity, or race related topics, we have to also acknowledge that many of these events can further perpetuate trauma for library staff that are also from these groups. But these kinds of threats and this kind of workplace trauma is growing right now. And threats of violence and also experiencing actual violence can cause library staff to either experience symptoms of a new mental health condition or worsening of a pre-existing mental health condition. So we're seeing lots of library staff describing mental health symptoms that are either starting or have started since they started working in the library or have worsened since they started working in the library. So those are experiences of firsthand trauma that are impacting library staff. This slide is talking about what we call secondary or vicarious traumatization. So, secondary or vicarious traumatization is a pretty common experience for people in different helping professions who are exposed to other people who've experienced trauma. And this is when we can actually develop a trauma response, just as if we were the person who experienced the trauma firsthand. But we develop that trauma response because of working really closely with other people who are experiencing the firsthand trauma. And the risk of developing secondary traumatization is greatest for people who are women, people who are highly empathetic by nature, people who are trauma survivors themselves, people who are untrained or undertrained for dealing with others' trauma, and people who are socially or organizationally isolated. And when we think of library staff groups, it's not uncommon to see people who are very empathetic, who want to help, and who really are undertrained or untrained for working with and managing trauma. We also sometimes see people who are isolated in their roles or don't have many opportunities to talk about the trauma they're experiencing. And so those things are increasing the risk of secondary trauma. And secondary traumatic stress or vicarious trauma compromises the care of other people. It can lead to hopelessness, to feelings of worthlessness, or not being able to do one's job sufficiently, and can actually lead to turnover or people leaving their job or leaving the field altogether. And again, it causes trauma responses just as if the person had experienced trauma themselves. So they're also, besides just getting frustrated with the work they're doing or feeling hopeless about work, they also may be experiencing many of those other trauma responses I talked about on that previous diagram. When we look at library staff who are experiencing trauma, we see some really common behaviors. So when we talk to staff who've experienced trauma, we hear a lot of times that people are describing feeling very burned out. They feel depressed. They feel really ineffective in their job or powerless at work. We often see staff who dread coming to work or they may call in sick frequently. We see staff who isolate and want to be left alone or who may be irritable or come across as rude. We see staff who are really frustrated by working with people, who maybe once were really creative but have lost that ability to focus and be creative. We see staff who may have trouble sleeping, or staff who are using unhealthy coping mechanisms themselves, like drugs or alcohol or overeating. And we see staff who have trouble setting healthy boundaries with others. And these are really normal behaviors that we're seeing in staff groups who are experiencing trauma. So separate from trauma, whether we're talking about firsthand or secondary trauma, we also have burnout, which is a serious problem right now in many library staff groups. And burnout is a separate condition. So it actually has a definition by the World Health Organization of a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. And I want to come back to that definition in just a minute because I actually I take issue with that definition. But there are three different components or dimensions to burnout, and they are that the person has to have feelings of exhaustion. They also have to have increased negativity or cynicism about their job, and they have to have reduced effectiveness at work. And these three things have to be present for somebody to be actually meeting the definition of burned out. The risk of burnout is increased by people not having any control over their work, by not having adequate resources to do their jobs, by having unclear roles or job expectations, dysfunctional work dynamics where they may feel unsafe to talk to other people or complain about challenges that they're having, or they may feel like they're not free to be themselves. people who are isolated or lack social support at work or at home, and having a work-life imbalance, which that last one's a little tricky because as people get more stressed at work, they tend to have less energy for things at home that used to be enjoyable, their social relationships or activities that they used to do. And so as people's stress grows, we see that that work-life imbalance becomes greater. And burnout results in low morale and disengagement at work. And again, often people leaving their jobs or leaving the field altogether. When I said I wanted to come back to the definition, it's because of this. This definition makes it sound like it's a really individual problem, that the person hasn't managed their stress level well enough. But when we look at these risk factors, most, if not all, of these risk factors are actually organizational factors. So when we're talking about people's amount of control over their job, the clarity of the roles, the having the resources they need to do their jobs, having psychological safety and really functional work dynamics, all of these are organizational factors. So this is actually good news for us because what it means is if we can intervene at the organizational level and change some factors at the organizational level, we can actually reduce the rates of burnout that our library staff experience. But all of these things, whether we're talking about burnout, firsthand trauma, or secondary trauma, these are really complex and interconnected issues which require broad organizational solutions to address. And so that's where trauma-informed librarianship comes in. So trauma-informed librarianship is one strategy for trying to address what's happening in libraries and reduce the harm that is happening to people who are working in our libraries and also the harm to people who are visiting our libraries who are trauma survivors themselves. So when we're talking about trauma-informed librarianship, what we mean is that everybody in that library is really aware and understands how widespread trauma is, understands the signs and symptoms of trauma and how it impacts people in the space. And again, whether we're talking about patrons or coworkers, understands sort of how it shows up, that people in that library really respond to that knowledge by actually integrating it into practice and changing policies and practices of that library based on this knowledge that they're gaining about trauma. We see library staff and everybody in that library really focusing on being sensitive to the traumatic experiences of others and trying to reduce the impact of trauma on people and reduce re-traumatization of people in the space. And we really learn to look at everything through this lens of asking ourselves, what might have happened to this person to make them be doing this behavior? Rather than our sort of human response when we see somebody do something inappropriate or bizarre, our human response is to think, what's wrong with that person for them to do that? But this is a conscious sort of reframing and thinking of things differently and stopping ourselves when we think automatically what's wrong with somebody and instead thinking, well, what might have happened to that person for them to be acting this way right now? And thinking about things through that lens doesn't change that we have to intervene. So if somebody's in our library and they're violating a policy or they're doing something they're not supposed to do, we have to respond. But changing the way we view people and thinking through this trauma-informed lens can help us have more empathy, help us have more patience, and help us respond with a more restorative kind of response rather than a punitive one. And again, a trauma-informed library has to focus on not just patrons, but also staff. The focus is really on everybody that's in that library. When we talk about becoming a trauma-informed library, we're really talking about an intentional effort. It's a long-term process, a long-term goal that a library is on. So it's not like a library can say, next week we're going to be trauma-informed. It really is instead this ongoing process rather than a destination that a library reaches. The benefits of adopting a trauma-informed approach are very broad. So trauma-informed approaches, they're really new for libraries specifically, but trauma-informed approaches have been used in many different public serving organizations for quite a few years now. And what we've learned is that adopting a trauma-informed approach creates a healthier organization for everybody in that organization, both employees and the people served, that it helps prevent re-traumatization, which can then reduce the need for both physical and mental health care and the costs of treatment for people that are interacting in that space. It helps create and sustain a welcoming place for all, which is really important for a library. That's a mission of many public or all public libraries, is to create a welcoming and inclusive space for the public. Trauma-informed approaches have been found to reduce the number of escalating events and disciplinary actions that have to take place in that space, and increases overall morale, communication, shared decision-making, and overall satisfaction among both staff and customers or patrons. So there are 6 different principles of trauma-informed care, and I'm going to talk about what each of these look like in a library. And the 6 principles are safety, trustworthiness, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So the first one is safety. And when we're talking about this principle of trauma-informed care, we're talking about both physical safety, so trying to make sure that the environment is physically safe for everybody, but also psychological safety, which means that people feel able to be themselves. They feel comfortable interacting in a genuine way. They can be free to be themselves, and they're respectful of other people as well, being themselves. So when we think about these things in a library, so physical safety, when we're working with the public, we can't guarantee 100% that the library is always going to be safe for everybody, right? Because sometimes things happen, people come in, something, happens that we didn't necessarily see coming and we couldn't necessarily prevent. But this means that we have policies in place and that people are well trained to respond to these incidents when they happen, that we can prevent the incidents that are preventable, and that, when something unpreventable happens, that we can regain safety quickly because people can respond swiftly and consistently to those threats to safety. It also means our library is kept clean and well lit. We've got well marked exits, that we do everything we can in our power to keep the environment safe for everybody there, physically safe for everybody there, and that we're as prepared as possible for threats to safety. For psychological safety, this means that we are intentional about creating a space that welcomes everybody, and that administrators and staff really model supportive and caring relationships for everybody, treat everybody with respect, enforce policies consistently so that people know what to expect. That's part of psychological safety. And that we have clear boundaries and expectations so that, again, people can know what to expect, which helps them feel safer in our space. The second guiding principle of trauma-informed care and how it looks in a library is trustworthiness. So this means that we are transparent in our actions, that our actions as library staff and as a library match our stated values and our stated mission. So we want our actions to match our words. We want to make sure we're upholding our commitments, and that people, again, know what to expect from us, and that we're trustworthy. We're going to follow through with what we say we're going to do. So when we're putting this in action, it means that, again, we are very intentional that our policies and practices match what we say our values are, that we're very transparent about our policies and our procedures, that we are consistent about how we apply those with people so that, again, people know what to expect from us. We make our expectations clear and publicly known. We use shared decision-making processes so that people know they've given feedback, where we communicate and are trustworthy or transparent about how we came to a decision, what information we gathered that led to that decision, et cetera. We share that as much as we're able to with people. The third principle of trauma-informed care is peer support. So this means we create a system in our library where people at all levels can learn from each other, support each other, encourage each other. And we're usually really good in libraries at doing this for patrons. So when we think about patron focused programming or services, it's not uncommon to see many different things offered in a library that allow patrons to gather around shared concerns or shared interests and support each other. We also see libraries sometimes that are adding mutual aid or non-clinical kinds of support groups, or allowing their space at least to be used by support groups in the community. We see libraries that highlight books by authors with lived experience on the topic that they're writing about. So again, people can access those resources and learn from the experiences of somebody who has been there, done that. So we often have opportunities for patrons to support one another or create opportunities for peer support. It's more difficult sometimes to think about how we can do this with staff. But when we think about staff and offering peer support opportunities, we think about ways that we can create peer support groups so that staff can talk together about things they're experiencing in the library and encourage each other. We think about something called reflective practice, which is a strategy that comes from many of the other helping professions like social work, psychology, uh, healthcare, education. There are a number of different disciplines that use reflective practice strategies. And what these are opportunities for people to talk and really process the work and the stress of the work, but also reflect on what kinds of skills they may need to be better prepared for those incidents in the future, what kind of policies or practices might need to be changed in the library to make sure that people are better prepared for these kinds of things in the future, etc. So reflective practice is a way for processing things that are happening, but also learning from them and continuing to move forward and grow as individual employees and as a team. So reflective practice groups are a way that libraries can offer peer support for staff. We also think about ways to offer mentoring programs or to pair up senior staff with more junior staff. And just creating opportunities. Some libraries have added affinity groups or groups of people that share an interest or share a concern or share some sort of characteristic. And thinking about ways like that is really important to create opportunities for staff to support one another. The next guiding principle of trauma-informed care is collaboration and mutuality. And this is remembering and keeping in mind that we're all in this together. We're all part of the same team. That as humans, we heal, we progress, and we thrive through the power of relationships with each other. So when we think about practices in a library that demonstrate collaboration and mutuality, what we see are administrators and really all staff from the top down using a relationship first approach, really focusing on building rapport with each other, building relationships with each other, using solution focused language, really using shared decision making protocols to get feedback from people at all different levels, make decisions collaboratively when possible, move towards these shared goals collaboratively when possible. We want to reduce hierarchies when we can. And I know sometimes in a library, libraries are very hierarchical organizations, and sometimes we may need the positions to be hierarchical so that we know who to go to with concerns and things get elevated the way they're supposed to along the different channels of the organization. But when I talk about reducing hierarchies, what I mean is that we make sure decisions aren't made from a top-down way, and that instead people at the top of the organization are ensuring that there are channels of communication from all levels of the organization that can help with making those decisions and informing those decisions collaboratively. The fifth guiding principle of trauma-informed care is empowerment, voice, and choice. So this is related to collaboration and mutuality. And what it means is that we reduce power differences when we can. We give everybody a voice in programming and services and policies when we can, and we allow choices whenever possible so that people are empowered to give feedback and give input, and then they're empowered to make choices about themselves and what they're able to access as much as possible. So this means that at the library, we try to ensure that patrons, and especially patrons from oppressed or vulnerable or marginalized groups, have opportunities to have their voices heard, that we do our best to ensure diversity among our staff, our board members, our decision-making groups, that we make sure again that the people who are making decisions are diverse, and that the voices that are at the table are diverse. We want to make sure that patrons have a choice of services and programs when possible, or we remind them of choices that they have. And that's important to do. Like, people don't like being told what to do. So even when somebody is violating a policy and we have to have a conversation with them about that, if we can frame it in a way that gives them a choice and gives them some control over the outcome, that's always ideal. And we want to make sure that we're making decisions in our library that are informed by feedback from people at all levels. Then the last principle of trauma-informed care is cultural, historical, and gender issues. So this means that we keep in mind that there are contextual factors that impact our own choices and behaviors, that there are demographic factors that actually impact our likelihood of being exposed to trauma, and that we make equity-minded decisions to try to repair or reduce harm for certain demographic groups whenever we can. So this means that we respond to the cultural needs of both our staff and our patrons, that we review our own policies and practices in our library to make sure that we are monitoring for disparate outcomes for different groups, and that we make equity-minded decisions to correct when we do find that there are disparate outcomes for different groups, that we think about where we can offer culturally relevant programming and services, and also create opportunities for cross-cultural connection between people. And we want to make sure we're really assessing the needs of marginalized communities that are accessing our library and working in our library, and making changes to address those individuals' needs. So those are the 6 principles of trauma-informed care and how those look in general in a library. What we would expect is that a library that's striving to be trauma-informed would really look for the presence of all 6 of those principles and make sure that those principles are being demonstrated throughout the policies and practices of that library, and policies and practices pertaining to patrons and staff. So many libraries have started adding social workers. I know, part of the conversation in this group is about social work in libraries. So many libraries are now adding either on-staff social workers or collaborations with social workers in the community, or social work interns through a local university. And so the first thing I want to talk about is how how library-based social workers can help with trying to become trauma-informed. And then, because there are so many libraries that do not have access to a social worker, I'm going to talk next about things that libraries can do even without access to a social worker. So library-based social workers can do a lot of different things to help guide a library towards becoming more trauma-informed, or help the library continue to be intentional about becoming trauma-informed. And social workers are trained to work what I call across the micro to macro continuum of services. So social workers are trained to intervene and assess and work at the micro level, which is with individual people, but also at the meso level, which is working with groups of people or facilitating groups and understanding group dynamics. And then also at the macro level, which is more the organizational or the community level. So when we look at different activities that social workers can do in a library that can help become more trauma informed, on the micro level, they can help with crisis intervention and de-escalation. So as patron challenges happen, a social worker can often help with de-escalating those situations, intervening, helping to assess somebody's needs and connecting them with what it is that they need. They can connect individual patrons to needed resources separate sometimes from crisis intervention and de-escalation, just as an ongoing practice, and can assist individual patrons with accommodations. And here in the US, we mean accommodations in an accessibility way related to disability. So what this means is that they can assist if we have somebody using our library who needs a disability-related accessibility change made to ensure the library is accessible for them. The social worker can often help with that process. At the meso level or group level, a library-based social worker can help by facilitating these support groups I talked about with staff, or facilitating these reflective practice groups, and helping to have opportunities and create opportunities for staff to process the stress of the work, but also to identify when they need new skills, or when there needs to be some sort of organizational level change to improve how staff can intervene with the situations that are happening. A library-based social worker can also provide training at the meso level on boundaries or self-care, de-escalation, those kinds of things for staff. They can facilitate book discussion groups for patrons on trauma-related or trauma-informed books or resources. They can create and help facilitate mutual aid support groups for patrons around certain kinds of issues or challenges. And they can facilitate programs in your library about resilience, mindfulness, or self-care. At the macro level or the community or organizational level, the social worker can help review library policies, looking for different outcomes for different groups and making recommendations for policy changes that could increase equity or fairness in your library. They can help create resource guides for both staff and patrons around specific kinds of needs to ensure that people are able to access the resources that are available in your local community. They can help examine space in your library for accessibility concerns. They can do needs assessments of patrons or staff groups to help you then identify strategies that you may use moving forward. They can help to inform safety protocols, especially in libraries that are adding security. Often social workers work directly with the security team to help inform and ensure that there are trauma-informed safety protocols. The social worker can help facilitate connections between your library and other needed services or organizations and can help with assisting to create and sustain a psychologically safe environment in your library. And all of these things, the one sort of disclaimer I want to give is that these things sometimes use different skills. So sometimes I've seen libraries hire a single social worker and think that that social worker is going to be able to do all of these things and serve patrons and staff. And we often use different skills for different groups. And so you've got to think about what the priorities are for your library and make sure that you are creating the position description with that in mind and those priorities in mind, and looking for a social worker that has that specific skill set and type of experience, because some of us specialize in different areas, and so some may be better at providing clinical kinds of services where they may be facilitating support groups with staff, for example, while others may be better at case management and serving people experiencing homelessness or serving patrons in some way. So just know that these skills that I've listed here are these things that library social workers can do. You can't necessarily expect a single social worker to do all of these things at the same time, but these are all things that social workers can do to help in your library. So for libraries without social workers, there are things that you can do to help move your library towards a more trauma-informed approach. So the first is really focusing first and foremost on creating a culture of care and making sure that from the top down, everybody in the library is demonstrating a relationship-first approach and that people clearly matter most in the library. And again, that means staff as well as patrons. We want to make sure that in your library, you're ensuring accessibility of the library for everybody, both employees and patrons, and addressing accessibility related challenges for people with disabilities, and making those changes as needed to ensure your space, your services, your programming are as accessible as possible. We want to make sure that we're acknowledging and openly talking about mental health. So one of the things that often happens in lots of our communities is that there's still such a stigma around mental health. We talk openly about physical health. Nobody hesitates to say they have a headache, or, right now people say they have the flu or they have COVID, or like people talk openly about physical health, but we don't talk as openly about mental health. And it's really important to just openly acknowledge mental health and acknowledge that we all experience really difficult and stressful things in the work that we're doing, and that the work does impact our mental health and well-being sometimes. We also want to make sure that we offer debriefing after significant events, and we really normalize discussing these difficult and stressful events that happen in the library. And my choice of wording is important here, because I say offer debriefing because when we look at trauma and how people process trauma, some people actually have a greater trauma response from being forced to debrief or talk about or relive a traumatic experience, while other people benefit from that. And so we need to be respectful of that difference and offer debriefing or opportunities for people to debrief, but allow people to make a choice not to do that if it's not something healthy or positive for them. We also want to make sure, if we're administrators, that we're ensuring or advocating for an adequate support program for staff. So, where we can advocate for mental health resources for our staff is really important. We want to consider incorporating self care and wellness focused activities for staff throughout the day. So, often we emphasize self care rather than community care. And we have to think as an organization about how we can incorporate wellness focused activities. Can we create some sort of sensory friendly environment for staff? Can we create time in our schedule for staff to gather to talk about things that they're experiencing? Can we create support and mentoring, opportunities? Like, what can we do as an organization to incorporate these self-care kinds of activities and supportive activities throughout the day? We want to make sure we're implementing shared decision-making protocols and that we're allowing opportunities for feedback from people at all levels of our organization, that we're emphasizing the importance of reflective practice and creating time and space for people to talk about things in our library. We want to make sure we have plans for handling psychological and physical emergencies so that people are equipped and prepared to address all kinds of crises that may happen in our space. We want to offer staff training in mental health first aid when we can. There's an international version as well. This is an evidence-based intervention for people who don't work in mental health kinds of environments, to be prepared for identifying when there's a mental health or a substance use related crisis and knowing how to respond effectively. And it's been found not only to increase and improve the response of people with these kinds of things that happen, but also to improve confidence in people who are working in libraries to be able to work with all kinds of crises that may come up. It's always recommended to create some sort of trauma-informed work group in your library that has a variety of people from different perspectives in your library that can help assess whether these 6 principles are present and really develop some strategies and self-monitor progress over time. We want to build our collection of relationships with community partners as needed to address patron and staff needs. And then don't be afraid to seek consultation as needed from a consultant, from a local university. There are other partners, sometimes a community partner in your local area, somebody who may specialize in trauma-informed approaches that can help partner with your organization. So I know we just have a few minutes. I'm going to stop my screen share so I can see if there are questions in the chat, but we have a couple minutes for any questions that have come up.
Thanks so much, Beth. That was great. Yeah, as Sabine noted, feel free to put your questions into the chat or the Q&A. I had a question, Beth. I was wondering about just your ideas, practical ideas for getting your administration on board to take a trauma-informed approach to librarianship. A lot of those things you noted are really organizational factors, right? So yeah, do you have any suggestions for that?
Yeah, it is important that this really be a top-down approach. You have to have the support of people at the top of the organization to move it forward. It can be helpful to present data and information about how these approaches have been positive for many other kinds of organizations. I think we're going to share the slides after this and the recording. So at the end of the slides, I've got some additional resources. So those can be helpful to present to your administration to help make a case for why this is important. But people have to, this does take intention, it takes effort, it takes resources. And so it is important that administration be on board, and as much as you can share information with them about the broader benefits, that can help get buy-in.
Thank you, Beth. It's been lovely and very informative session as usual. I just have one question, that while libraries are finding their way to engage or hire social workers, because we know that in Australia it's really in its infancy. Is there any suggestion in the interim to transition towards that stage where they can have full-time social worker, and in the interim, what can they do?
Yes. So that's how I actually came to work with libraries in the first place. Somebody had reached out to me as a university professor at that time, just asking for a needs assessment. So there are the actually in the book that's coming out in December, the needs assessment, some of the needs assessment questions I've used are in that book, and they're going to be available to anybody. But often if you can collect data in your library about the kinds of needs, that can help to, again, justify the use of resources for a social work collaboration. And many libraries have started because, as you mentioned, hiring a full-time social worker, that's a big step, and that uses a lot of financial resources in particular. But many libraries have started just by developing a partnership with a local organization that may have a social worker who shares a similar population that they serve as what you're seeing in your library. So, for example, some libraries that have large numbers of unhoused patrons may partner with an organization that serves people experiencing homelessness who already needs to do outreach with that particular group. And they may agree to come into the library one day a week or one day every other week or something, to meet individually with patrons or address some of the challenges. And often that's how libraries start it with these kinds of collaborations, is just collaborating with a community partner. Sometimes other agencies don't realize what people are seeing in the library, so it takes outreach with that organization to inform them of what you're seeing in the library and what the needs are. But they can often come in, there can be a partnership like that, that then you can collect data about how many people are being served, how many people are in need. Again, that data can help make that case for why the library might invest in their own social worker ultimately.
That's just last one question. I'm mindful of the time. Do you think the universities, local and partnering with local libraries, that can help fill the gap in the interim?
Yes. So many libraries that over in the US, that's what's happening a lot. We've seen a huge sort of explosion in the number of social work students that are placed in libraries to do an internship or a practicum. So that is a way to get a free or low cost service. You do have to work out, like there are some additional concerns about supervision, who's going to supervise those students. There are some things that have to be worked out, but that is often how libraries are starting, is by having either these partnerships with professional social workers in the community or partnerships with a university for a social work intern, that can sometimes that student can then do a needs assessment or collect data that may be able to be used to help ultimately make a case for a grant or some sort of financial assistance or financial support for a full-time position.
Thank you very much, Beth.
Thanks, Beth. And yeah, Barbara Johnson just noted in the chat that it's really relevant. They have a social worker at their library, and they've really impacted in a positive way for both staff and customers. So that's great to hear, Barbara. Thank you. Yes, and we are at our little over our time now. So just thank you so much, Beth, for sharing your work with us. It's always great to hear what you're working on. And so your lecture the recording will be posted on our website. That's in the chat. Sabine included that there. And I'll just pop this screen up, which has our, so we have a few other lectures coming up from some other scholars in the US. Dr. Mary Provence is the next one, Patrick Lloyd, and then Leanne Mitchell in November, at the end of November. So feel free to come to all of these or watch the recordings later is great too. So thanks so much, Beth.
Yeah, thanks for having me.
Have a great day.
Thank you, Beth. And
have a great night.